Concept of management. Management is a broad and essential concept in various fields, including nursing. It involves the coordination and organization of resources, people, and processes to achieve specific goals effectively and efficiently. In nursing, management encompasses several concepts that are crucial for ensuring high-quality patient care, optimizing resources, and fostering a positive work environment. Planning. Planning involves setting goals, defining objectives, and outlining the steps needed to accomplish them. In nursing management, it includes developing strategies for delivering patient care, establishing policies and procedures, and allocating resources appropriately. Effective planning ensures that nursing activities are aligned with the overall goals of the healthcare organization. Organizing. Organizing focuses on arranging resources, such as staff equipment and supplies, in a structured and coordinated manner. In nursing management, this involves determining the optimal staffing levels, creating work schedules, and ensuring the availability of necessary supplies and equipment. Organizing also includes establishing clear lines of communication and defining roles and responsibilities to promote efficient workflow and teamwork. Staffing. Staffing refers to the process of recruiting, selecting, and assigning qualified individuals to fulfill specific nursing roles. It involves assessing staffing needs, conducting interviews, and making hiring decisions. Effective staffing ensures that the right personnel with the appropriate skills and knowledge are in place to provide safe and competent care to patients. Directing. Directing involves guiding and leading the nursing staff to achieve desired outcomes. It includes effective communication, delegation of tasks, and motivating employees to perform their best. Nurse managers provide guidance, support, and feedback to their team members, fostering a positive work environment and facilitating professional growth. 3. Controlling. Controlling is the process of monitoring and evaluating performance to ensure that it aligns with established standards and goals. In nursing management, controlling involves regularly assessing patient care outcomes, monitoring adherence to policies and procedures, and implementing corrective actions when necessary. It also includes quality improvement initiatives to enhance patient safety and satisfaction. 4. Decision-making. Decision-making is a critical aspect of nursing management. It involves analyzing information, considering alternatives, and selecting the most appropriate course of action. Nurse managers make decisions related to resource allocation, staff management, and problem-solving. Effective decision-making requires a balance between evidence-based practice, clinical expertise, and consideration of ethical and legal implications. Leadership. Leadership is an integral part of nursing management. Effective leadership inspires and influences others to work towards common goals. Nurse leaders demonstrate qualities such as integrity, empathy, and effective communication. They motivate and empower their team members, fostering a collaborative and supportive work environment. Continuous improvement. Continuous improvement involves an ongoing effort to enhance nursing practices, processes, and outcomes. Nurse managers play a crucial role in facilitating quality improvement initiatives, fostering a culture of learning, and implementing evidence-based practices. They encourage feedback, engage in reflective practice, and support professional development opportunities for their staff.